Let us discuss about Pulsus paradoxus. The normal blood pressure in an adult ranges about 120 by 80 millimeter of mercury, whereby 120 signifies the systolic blood pressure and 80 the diastolic blood pressure. So during every cardiac output, the pattern of the blood pressure is like this. But during inspiration, there is a physiological drop in the systolic blood pressure. Let us look into the mechanism that leads to this drop. During inspiration, the intrathoracic pressure also reduces. When the volume of the lung increases, the pressure decreases, and because of the reduced intrathoracic pressure, the blood from the superior vena cava and the inferior vena cava pools into the right atrium. Because of the excess venous return, there is excessive blood flow to the right ventricle, and there is a distension of the right ventricle and increased pressure. Because of the distension in the right ventricle, the interventricular septum slightly bulges towards the left. The distension of right ventricle occupies some space of the left ventricle, which is also known as physiological ventricular interdependence. The increase in volume of one chamber of the heart is allowing the other chamber to decrease its volume, and that is called as physiological ventricular interdependence. Because the left ventricle has to contract effectively to enable an efficient stroke volume, the decrease in the pressure of the left ventricle decreases the stroke volume, which leads to reduction in systolic blood pressure. Also, during inspiration, the lungs expand and there is an increase in the pulmonary compliance. Because of the increase in the pulmonary compliance, the venous return to the left atrium is reduced. Because the venous return via the pulmonary veins is reduced to the left atrium, the blood flow to the left ventricle is also reduced. As per Frank Starling's law, the amount of contraction produced by a chamber depends on the myocardial stretching. If the volume of blood entering into a chamber is less, then the myocardial stretching is also less. When the myocardial stretching is less, then the amount of contraction produced by the chamber is also less. When the contraction produced by the left ventricle is less, then the stroke volume reduces, thereby affecting the systolic blood pressure. This systolic blood pressure drop is transient and it is physiological during the inspiration. The difference between the normal systolic pressure and during inspiration should not be more than 3 to 4 millimeter of mercury. When the difference between the systolic blood pressure increases or goes beyond 3 to 4 millimeter of mercury, then that condition is called as Pulsus paradoxus.